Okay, let's unpack this. Have you ever considered a condition, it's so prevalent, yet often discussed in hushed tones, it impacts millions globally, causes, really distressing symptoms like chronic bleeding, sometimes pain. We're talking about hemorrhoidal disease. And for a long time, the solutions, well, they felt like a choice between just living with it or facing traditional surgeries, and those
Yeah,
often come with a lot of pain, right, and a lengthy recovery.
that's absolutely right. The traditional spectrum, it's always involved a pretty significant trade-off. Sure, the invasive surgical procedures can be effective, but they've always carried that risk of considerable post-op pain. And yeah, really extended recovery times for patients.
But today, we're doing a deep dive into something really promising, a big advancement. Hemorrhoid embolization. Think of this maybe as your shortcut, a way to understand a groundbreaking technique. It's minimally invasive, and it's genuinely changing the landscape of care for what's a really common problem. So our mission here is to pull out the most important nuggets of knowledge from expert radiology reports, from the research, give you a crystal clear picture of why this actually matters.
Yeah, and what's truly fascinating when you look at the research is how this technique, it just fundamentally shifts the treatment paradigm. Instead of cutting tissue, removing it. Endovascular embolization, which is guided by advanced imaging, it precisely targets the blood vessels, the ones feeding the hemorrhoids. It's really about reducing that blood flow, the flow that causes symptoms like recurrent bleeding. And it does this without the trauma of surgery. A key insight, really, is that it preserves the critical anal tissue. And its natural function, too. That's something traditional surgery, well, it often compromises.
Okay, so that pinpoint accuracy you mentioned, it sounds absolutely key here. How do you, as interventional radiologists, actually achieve that kind of precision in such a, well, complex area?
Right. That's precisely where our expertise in advanced imaging comes in. Think specialized CT scans, angiography.
Yeah.
It lets us create a very detailed roadmap, essentially. Every patient's vascular system is unique, so we map their system. This ensures we target only those specific arteries feeding the hemorrhoid. We avoid collateral damage. It's like achieving surgical-level precision, but without the actual surgery.
That's a huge distinction, a really huge distinction. So who exactly is this procedure for? Is it like a solution for everyone who has hemorrhoids?
Good question. It's primarily indicated for symptomatic internal hemorrhoids, especially those with persistent bleeding. That's typically grades 2 up to grade 4. And what's really crucial is its applicability for patients who might have contraindications for traditional open surgery. Maybe they have other medical conditions, like, say, hypercoagulable states where their blood clots too easily, or frankly, just for patients who desperately want to avoid the significant pain and that prolonged recovery of the older methods.
That shift towards patient-centric care, that sounds like a massive step forward. But realistically, are there any downsides, limitations, maybe things patients should be aware of beyond what it can't fix structurally? I mean, you mentioned it helps with bleeding, but what about other symptoms?
That's an excellent point. So while it significantly improves bleeding and overall quality of life, and often reduces pain too, the research does show it offers, well, mixed results or little improvement for structural issues, like prolapse where tissue bulges out, or skin tags. So this means it's particularly well suited for patients whose main complaint really is the bleeding. Not so much for those primarily looking for a fix for those external structural things. Definitely not a panacea for all hemorrhoid problems.
Understood. Okay, so for our listeners, how is this actually done? What does the patient experience during the procedure itself?
From the patient's perspective, it's actually quite straightforward. It's typically done as an outpatient procedure, often just under local anesthesia. We get access through a tiny entry point, maybe in the groin, sometimes even the wrist. Then a very small catheter, guided by imaging, of course, is navigated to the specific arteries, the ones supplying the hemorrhoid. Once we identify those target vessels, tiny embolic agents are delivered. Think of them like microscopic beads or coils. They block off the blood flow. The goal is complete exclusion of those target arteries, essentially starving the hemorrhoids of their blood supply.
And the data, from what we've seen in the reports we looked at, it's really compelling on the outcomes, isn't it?
Oh, absolutely. Hemorrhoid embolization, it boasts incredibly high technical success rates, often over 97%. And the clinical success rates, equally impressive, usually hovering around 80–90%. That shows significant improvements in bleeding scores, pain levels, and overall quality of life. What's truly remarkable, I think, from our deep dive into this data is how consistently these success rates hold up, even years later. which kind of challenges those prior assumptions that only surgery offered really lasting relief.
And the safety front, that seems to be where it really stands out. The studies we reviewed consistently report no severe adverse events, no major complications, and crucially, 0 instances of bowel ischemia or necrosis. That's where bowel tissue could die, right?
It's just a concern.
Exactly.
That's a critical safety point. Minor complications, things like small superficial ulceration, they can occur, but they're typically self-limiting. They resolve on their own. Now, while it's incredibly promising, it is worth noting, the field's still evolving. We definitely need more high-quality long-term trials. Randomized controlled trials. There's also a recognized need for more robust comparisons with other non-surgical treatments. And standardization of the technique itself. And figuring out the optimal embolic agents to use.
So what does this all mean for you listening? Hemorrhoid embolization, also known as rectal artery embolization, it really represents a powerful shift. A shift towards patient-centric care. It offers significantly less pain and remarkably faster recovery compared to those traditional surgical approaches for symptomatic hemorrhoids. It's not just an alternative, it's becoming a vital option, particularly maybe for patients who need to avoid the challenges of open surgery or simply want a less invasive path to relief.
Yeah, this consistent safety profile and its effectiveness, especially, as we said, in controlling bleeding, it truly redefines what's possible for such a common condition, and it raises, I think, an important question for the future. How will these patient-friendly, minimally invasive techniques continue to redefine treatments for other common conditions? And what new avenues for rapid, less burdensome recovery will emerge next in medicine?
Definitely something for you to mull over until our next deep dive.